Goodluck Jonathan inaugurates General Hospital in Ikorekpene, Akwa Ibom State. Journalists across the country converge on Calabar to intensify public awareness on prevention of mother-to-child transmission of HIV and AIDS. Plus, NNPC engages critical stakeholders to find lasting solutions to road network challenges in the country. Details shortly. Good evening and welcome to Nta Calabar News at 7. I am Ode Alenyo, and now the news in details. Former President Goodluck Jonathan has advised state governments and stakeholders in the health sector to strengthen health infrastructure and facilities in their states to better the healthcare needs of the people. The former president, who gave the advice while inaugurating a remodeled general hospital in Ikorekpene local government area of Akwa Ibom State, commended Governor Udom Emmanuel for his effort in improving healthcare delivery system for the people. Susan Asuko reports.
The Ikorekpene General Hospital, which has been remodeled to meet global best practices in healthcare delivery system, has a reconstructed maternity, pediatric and general wards, physiotherapy units, 2 new theaters, and a remodeled outpatient department, pharmacies, and new administrative block. Former Nigerian President Dr. Goodluck Jonathan noted that the impact of COVID-19 is unquantifiable, as it has left over 45 million deaths globally, heightened poverty, crumbled investment, and exposed the infrastructural and facility decay in the health sector. He commended the medical practitioners for their commitment and patriotism in the fight against the global pandemic.
The COVID-19 pandemic has opened the eyes of everybody, being the administrators, the politicians, the professionals, that health of a nation is key. And we must do everything to strengthen the infrastructure to deliver the health needs.
Healthy population and manpower development. We have tackled these 3 critical areas with messianic zeal.
The health facility is the 9th out of the 10 health facilities Governor Udom Emmanuel promised to provide across the 10 federal constituencies of the state. In Ikorekpene local government area, Susan Asuko, Nta News.
And still on the former President Goodluck Jonathan says the COVID-19 pandemic has challenged global leaders and stressed the need to rise up to the emerging health challenges by making conscious effort in the provision of standard health facilities in Nigeria. Susan Asuko again reports that the former president stated this at the opening session of the 2021 Physician Week in Uyo, Akwa Ibom State.
The former Nigerian President, Dr. Goodluck Jonathan, who was a keynote speaker at the 2021 Physician Week held in Uyo, noted that the adverse effect of the COVID-19 pandemic, aside from affecting world economy, also exposed the deficiencies in the healthcare system in developing countries. He appreciated medical practitioners who put their lives on the line to save humanity and urged state governments to do their best to improve on primary healthcare facilities and encourage multinational companies to support all efforts to reform the health sector and reposition it to combat any pandemic.
The sacrifice, compassion, commitment, resilience, empathy, and high sense of responsibility of medical doctors and other health professionals during this period underscore their crucial role in nation building and in advancing the cause of national security.
Akwa Ibom State Governor, who was represented by the Deputy Governor Moses Ekpo, expressed the hope that the newly constituted Health Reforms Committee will consider all issues that have been inimical to the expected United Nations healthcare standards.
In making the necessary huge sacrifice to strengthen the health sector in the state, our vision is beyond COVID-19. This is why your theme, Nigeria in the COVID era and beyond, health system, strengthening for national security and prosperity, is very apt.
High point of the event was the inauguration of the Nigerian Medical Association Secretariat in the state. In Uyo, Susan Asuko, Nta News.
And still on health, statistics shows that about 10 million people the world over died of thrombosis-related diseases and to reverse the narrative, the international community set aside 13th October to create awareness in the society and the need to forestall occurrences of many deaths by thrombosis. Erika Evie reports that the theme for this year's celebration is Eyes Open to Thrombosis.
Statistics reveal that about 904 persons die annually in Cross River State due to thrombosis, otherwise known as blood clotting. And this trend has become worrisome to stakeholders who say that a significant number of people in the society are ignorant of the symptoms and prevention of the disease.
Do you know what thrombosis is?
No, sincerely, I don't. I think this is the first time I'm actually hearing about that word. They can hold seminars, training, to train the society about it.
To create awareness to the people so that people will understand. Because a layperson could not understand what you mean by thrombosis.
To mark the day for the first time in Calabar, the Cross River State capital, stakeholders and medical personnel are advocating government to provide facilities for quick diagnosis, prevention and treatment of people with thrombosis.
And the flow of blood carries oxygen and nutrients for all cells of the body to get energy and continue the activities. So when blood clots within the human body, it will block further flow to areas beyond the place of blockade.
People should know that they need to keep fit, a lot of exercise, eating right.
Going down the community to educate them on thrombosis.
At a one-day workshop organized by Hematology and Blood Transfusion Department, University of Calabar Teaching Hospital, Calabar, the consultant hematologist, Dr. Akaba Kingsley, highlighted symptoms related to thrombosis and advised members of the public to embrace proper and routine check-up.
Before now, there has been several myths associated with thrombosis. Somebody dies without waking up or sleeping, and people say, oh, it's witchcraft. But sometimes it's just thrombosis. Because thrombosis is so severe that when it occurs, you might not be able to save that patient. Even with prompt intervention, it depends on how prompt you are. So we need to be proactive than reactive.
Some Nigerians are appealing that awareness should be extended to villages and faith-based organizations to prevent high rate of mortality in the society. In Calabar, Erika Evie, Nta News.
Equipping journalists with appropriate and updated information to impact the public positively on prevention of mother-to-child transmission of HIV and AIDS in Nigeria has been a burning resolve of the federal government and the United Nations in the last 17 years. Paul Ebel reports that sustaining the tempo is the reason for the convergence of journalists across the country in Calabar for a dialogue to reinvigorate and produce a work plan.
For Moses, like other participants in this media dialogue, having access to correct data to inform the public is not just about numbers but saving lives as it relates to mother-to-child transmission of HIV/AIDS, as well as helping children and adolescents living with the disease. It is towards achieving this purpose that the United Nations Children's Fund and the Federal Ministries of Information and Culture and that of Health are engaging these major stakeholders with series of lectures.
I really don't want to misinform my audience, so this has helped me to get the right information, connect me to right, experts to speak with.
But if you are consistent in your messaging, the message is able to be carried to them, and we're hoping that there'll be some behavior change to possibly impact the program in Nigeria.
We want to use this opportunity to increase the demand creation, increase talking to all our pregnant women to ensure that they seek these services across board and ensure that they get the right services from all points of care. Yeah.
People are hiding children because of HIV. Do it no more. Bring them out. Many health facilities will do HIV testing, and we move from there.
The message here, moving forward, is to see test all pregnant women as well as link and treat all HIV pregnant women while documenting and reporting such efforts towards attaining zero infection among children. Some of the participants share their experiences.
We have a group of journalists who are focused on helping to disseminate the messages and educate the public.
We are also there to ensure that we report what is necessary or update the people what they need to know concerning HIV and AIDS.
Stakeholders agree that despite the advent of the COVID-19 pandemic, the fight to eliminate mother-to-child transmission of HIV/AIDS has improved with policy documents as guidelines and different programs to create access to health facilities and antiretroviral drugs. In Calabar, Paul Abel, NTA News.
Stakeholders, including frontline health workers, are calling for concerted effort towards the provision of quality mental health care services at all levels. These were the views of some concerned Nigerians in Calabar as they joined the rest of the world to mark the 2021 World Mental Health Day. Correspondent has the details.
The COVID-19 pandemic has significant impact on people's mental health as it affects all facets of human endeavors, including those with pre-existing mental conditions ranging from neurological and substances use disorder. Concerned Nigerians sue for adequate care for people who are mentally retarded from families, friends, and the church, as well as to reintegrate this class of people into the society.
Parents don't have time for children. Like I told them, our illiterate parents produce doctors, lawyers. Now, educated parents produce Colombo because of no care. Parents should create time for their children.
One thing or the other might have led to that mental illness. Either depression, a serious depression could have led to that. Loss of loved ones could have led to that. So we should learn to accommodate them more.
Even the one caused by that very person. You don't abandon somebody simply because the person has mental illness.
Others enumerated causes of mental retardation to include drug addiction, peer pressure, depression, and environmental factors.
Some go into drinking all those hard drugs. It makes them have mentally disorder. So now, if they follow the will of Christ, definitely they will not be influenced by bad friends.
Please get close to your children, talk to them. Get close to your brother, talk to him or her, or your sister, talk to her, and let them know the implications of these things before they become people that you will need to visit in the hospital. When you are close to them, talk to them. When they see love, psychologically their system will change, and before you know it, you have them sent back to the society.
So whosoever that has, this kind of ailment has fall upon, is a result of the person distancing himself or herself or themselves from God.
NTA camera caught up with this mentally challenged person who gave his name as Erimagbo. He also claimed to be a degree holder with 15 years working experience with the Cross River State Cultural Center before he was laid off.
No, well, if you know what can I do, United States of America, it's better to be a security in person. No, I'm thinking of surgeon. Forwarding and the funeral. So the best way to be on contract. In 10 years' time, your governance can give you one room. In 15 years' time, your governance can give you a car. Because when you talk about being a star, who prepares your paper for pension and gratuity in 35 years' time?
The 2021 World Mental Health Day has as its theme, Mental Health in an Unequal World. The World Health Organization sets aside 10th October each year to create awareness on mental health issues around the world and to mobilize effort in supporting mental health services for people worldwide. In Calabar, Ode Alenyo, NTA News.
You are watching news reaching you live from the studio of NTA Channel 9 Calabar. You can watch this newscast on our YouTube channel at YouTube/NTA Calabar. We will continue the news after this time out. Nigerians in Cross River State are soon to enjoy poultry needs at affordable cost. This is because the Cross River State tunnel ventilated climate control automated poultry closed house located at Odupani, which is to supply the over 20,000 birds per day to chicken processing factory, has commenced its test run. Correspondent Paul Ebel again was there and completed this report.
We are right now at the Cross River State tunnel ventilated poultry closed house. This place, as you can see, houses about 15,000 of birds, which were raised right from a day old. In 5 weeks, they have become more mature, ready for slaughter. And we have 6 of these poultry house, closed house, here in Cross River State. This is a test run. And from here, it is feeding the Kalachika, the slaughterhouse that will be made ready for use and supply to customers. And we have here the officer in charge that will tell us more about the activities of this closed ventilated poultry house.
Here we have 2.5, which means we are going to give Cross Riverians better sizes at lower cost, and it's just amazing. It's just amazing. So, to continue the effect of this house, we have been able to see the difference between open houses and control house.
The poultry manager also speaks on other facilities which makes the ventilated closed house unique.
Everything is automated. You can imagine we served, the highest bag we served here was close to 110 bags before we started calling. Now, in serving 110 bags, you can imagine 2 persons serving that bag. So all we did was just to use the automation system. Pour, and the system takes it down to the chicken.
The matured birds are transferred to the chicken processing factory, also known as Kalachika, where they are processed and sold to the public.
This factory has an installed capacity of 24,000 birds per day. And the supply we were getting from all the mop-ups we were doing around all the poultry farmers here was not even up to 1,000 a day. So, however, that problem has been solved today, which is why we are here today. These birds are from the state poultry farm.
When all the 6 ventilated poultry closed houses are completed, it is hoped to meet the capacity of the modern chicken slaughtering factory. In Calabar, Paul Abel, NTA News.
As a follow-up to its effort in sustaining the current smooth supply and distribution of petroleum products nationwide within the festive period and beyond, the Nigerian National Petroleum Corporation (NNPC) has engaged critical stakeholders to find lasting solutions to the road network challenges. It will be recalled that following NNPC's intervention over the weekend, the petroleum tankers driver, a branch of the Nigerian Union of Petroleum and Natural Gas Workers (NUPENG), called off a planned strike action, agreeing instead to accept the dialogue option proposed by the corporation, a development that has sustained smooth supply and distribution of petroleum products nationwide. A statement by the Group General Manager Public Affairs Division (NNPC) Garba Jean Muhammad says the Chief Executive Officer of NNPC Mele Kyari took a decisive step towards actualization of his promise and holds a major stakeholders meeting at the NNPC Tower. According to the statement by NNPC, stakeholders have agreed on a framework for NNPC's intervention in critical road rehabilitation through the federal government tax credit scheme. In compliance with directives by the leadership of the organizing level in Cross River State, workers across the state have commenced an indefinite strike to press home their demands. Correspondence reports that non-implementation of promotion, non-payment of gratuity, and full payment of minimum wages are among the 13 points demand as contention between the labor and the government. The report.
NTA News crew as early as 8 a.m. were at some government offices and made the gates under lock and key. The chairman, Nigerian Labour Congress, Cross River State Council, Ben Opepi, says the option for the strike is necessitated by what he described as government insensitivity to the plight of workers in the state. Leader of the task force for the implementation of the strike, Mr. Idiege, in a swift reaction, emphasized that the withdrawal of the services of workers is to ensure that government meets the workers' demands.
It's critical in the minds of Cross River State workers that promotions implementation, which letters have been issued for over 6 years, are without implementation. That do not motivate workers' performance.
It is because we are shutting down the state for obvious reason. That's the reason that you see all MDAs, offices, new secretariat, old secretariat, House of Assembly, as it were, they are all shut down, and it is complete and indefinite.
Other items on the 13-point demand in contention are the non-implementation of 27.5% teachers' enhancement allowance, as well as inclusion of all employees who are yet to be on the list of the payroll of government. In Calabar, Ode Alenyo, NTA News. As the 6th edition of the National Youth Games commences, with screening of athletes, 30 states including Edo have arrived in Ilorin for the Games. Edo State, being one of the states that arrived earlier, complained of inadequate accommodation due to the fact that the students of University of Ilorin are in examination period, hence the complaint. Correspondent Kehinde Lamidi reports that the Federal Ministry of Youth and Sport Development has apologized to Edo State government over accommodation issues.
I'm also using this opportunity to sincerely appeal to Edo State. We are sorry for the lapses noticed by them, and this has been sorted out immediately. In fact, the head of the delegation, Madam Sabina, the SA to the governor, we spoke, and she assured us that everything is okay. And the Honorable Minister has directed that all expenses incurred as a result of the lapses should be refunded immediately. And this, I'm sure, will be carried out today by the Director of Grassroots Sports.
We recorded so many of the teams are on ground, and we have gotten accommodation where around the Polytechnic that to cushion the effect of the challenge we have here.
And finally, a recap of our top stories. Former President Goodluck Jonathan has inaugurated General Hospital in Ikorekpene, Akwa Ibom State, and called for improved health infrastructure in Nigeria. Journalists across the country have gathered in Calabar to intensify public awareness on prevention of mother-to-child transmission of HIV and AIDS. It was also in the news that NNPC has engaged critical stakeholders to find lasting solutions to road network challenges in the country. That's our package for tonight. For me, is good night.